Bhagavad Gita even, Krishna is mentioned, Dhyato Vishyam Punshah, Sangasteshu Pajayate. From the sense organ.
Whatever the patient, whether he is a poor patient or a celebrity, general ward patient, single room patient, deluxe room patient, I don't care. He is no more a patient, he is a family.
Dr. Gurava Reddy is one of the most widely searched and recognized orthopedic surgeon in India.
People say that you have to go to the hospital. I don't want to go.
Do what you like what you do.
So when the body starts healing, it is spiritually asking to have some pause.
A globally acclaimed orthopedic and joints replacement surgeon with over 4 decades of excellence and 60,000 plus successful joint replacement.
When you see that now this patient is at the final stage of the life.
Time, trust, touch, talk. Existing is simple, but living.
Namaste everyone. I'm sitting in front of Dr. Gurava Reddy and he is a visionary leader. Sir, you are highly searched in India and people are trusting you a lot. I really understand that people are knowing about you, about your journey, everything. So I would like to touch that portion where your personality is not revealed. Because when I came here on a hospital, I realized after seeing a lot of patients here, how you're managing your energy. This is something I'm like...
Patients are my energy.
Patients, it's okay.
The more I see, the more energy I get it.
Oh, but how, I mean, what is the best thing in your daily life that is non-negotiable and that's make you grounded? What is the main thing is?
Yeah, the
commitment with you.
Non-negotiable is humility. So I'm always feet on the ground, and whatever the patient, whether he is a poor patient or a celebrity, a general ward patient, single room patient, deluxe room patient, I don't care. He is a man who believed in me, who trusted in me and came to my room. Once he opens the door and comes inside, he is no more a patient, he is a family. He's a member of my family. That is how I look at it, and that is non-negotiable. So even after seeing 150 patients every day in my OPD, the last patient in the evening 7 o'clock, I give the same energy, same affection, same love and same smile to him. If I can't give, that means I cannot feel fit to practice.
That I really can see. And meeting with you is just, I'm getting the high level of energy from you too. In one word, if I would be asking to you that the level of energy recently here is how, because physically you can heal people, right? But this is not something they are completely getting healed. Where this disease, where is the problem is coming? Because if you see the Bhagavad Gita even, there Krishna is mentioned, Dhyato Vishyam Punshah, Sangasteshu Pajayate. Sangast sanjayate kama kama krodho bijayate.
What does that mean?
Yes, it means the disease, how basically it comes. Or the physical level we know, like, okay, you have the joint pain, you have so many problems. Comes from the sense organ. When your attachment is there, attachment leads to desire. You want to have that. And then when desire is gone, then it appears the anger. That krodha bhavati sammoha smriti vishbhrima means ki after the anger, your loss of memory, delusion happens basically. So that is a form of how the disease is coming out from your mental, from the chemical release from the mind. How is basically you correlate and how you cure it by physically, mentally, and how you're correlating with the bio-spiritual alignment, especially people who are not completely believing those areas, how you correlate, how you manage like that.
When you treat the patient with the brain, you treat them only outside. When you treat them with your heart, you treat them inside also. So that's what I would feel. The more I love, I give them. I love to touch the soul of the patient by my talking to him, by looking into his eyes, and by taking him as my member of the family. So that is the one which connects to me, the patient. That's very, very important to me. That's why if I don't have the time, I don't see the patient. I say, I'll see you tomorrow. Because I wanted to connect to him. That connect happens only when I got genuine time to speak to him. It doesn't need hours.
Yes.
It's 2 minutes. I spend 3, maximum 5 minutes with each patient. But that's enough for me to touch his soul. That is the power or privilege or opportunity given to me by the God.
That's really really is a very valuable point you said, because many of our new generations, the younger youths, they are now committing suicides. In a lot of the cases, we are getting it in the society, like these are the accidents as basically, it is more important right now to heal them from inside.
Correct.
And seeing you as a leader, as a personality, inspiration, I would like your inputs towards the young youths who are actually diverted from away the paths. They are not completely on the right path.
Yeah, of course, I'm not here to give a lecture to the youth.
Yes,
But,
basically the one word, one legacy, because after
Yeah.
you, if you would like to.
Yeah, but the youth should know the prioritization of their life. That means they focus on their life and they should enjoy what they do and they do what they enjoy. My mantra of life is one sentence. Do what you like and like what you do. Simple. It looks very simplistic, but a lot of us miss that bus. See, basically, you should like what you do. So you got a job, then you should start liking that rather than grumbling about it. If you don't do that, in that process, you don't do what you like. Suppose I like music, I like poetry, I don't do that. So either way, I'm a loser. So that's why the simple mantra in my life is, I like what I do. So for example, I'm doing this job, I like it. And then I do what I like. That's it.
What is the biggest misconception when people are visiting to your clinic, basically?
Misconception about the body or about the problem?
To be very frank, when people say that you have to go to the hospital, I don't want to go.
Yeah.
This
right,
is something is like I don't
The
want.
misconception is people all think that all the corporate hospitals
Yes.
are bad and all the doctors are there to suck your blood and to take your money, which is a very unfortunate myth. It's not right. 80% of the doctors are kind, 80% of the doctors are compassionate, 80% of the doctors put their blood and sweat to treat the patient. Many sleepless nights we go through to save you and your family. But people stopped realizing that. People stopped appreciating that. It's an unfortunate scenario. I don't know whom to blame.
So how do you, in this condition, you just personally you disconnect yourself?
Absolutely.
And how do you recharge your energy?
Yeah, exactly.
after
See, now
healing a lot
I'm
of patients?
25 years in practice.
Okay.
I got 2-3 court cases. People went and sued me in the court, but I don't mind. I do according to my inner conscience. Do good to the patient. But I may not save all the patients, but I comfort all of them. That is what I feel.
If I say, because after I really, when I was coming here and I felt a very kind of use, my emotion started imbalancing after seeing a lot of patients and all. Sometimes how to bless your body, how to keep yourself healthy and fit, that you cannot, that the person is actually mostly not aware of the fact to keep the body healthy and all. Because literally, I understand, even like being a doctor, and then you're seeing a lot of the patients like that, definitely you are giving them the good advice, but they're not at all following it, right? So sometimes it gives a kind of, this give you the negative approach towards them that, okay, even though you have given them the right points, but they are not at all taking it? Is this something is affecting you also? Many of the
Yeah, of course. All the patients are not the same. Some people understand, some people misunderstand, some people fail to understand. But it's a part of the game. I explain to them again and again, and I explain them in a language they are comfortable with, and I explain to the relatives, and so I use multiple methods of teaching. It's like a teaching process. So that makes all the difference. Sometimes I take a pen and paper, draw the diagrams, and
Okay.
show. Sometimes I show the models to show how bad the arthritis is, like that. So there are now many models and many methods to teach the patients, and so I keep all of them and I use all of them.
As I was going through for your the past, because I love when I was going to your past, what was the real challenge you really got that it has affected your practice so far? And
Yeah, there is nothing
It's
like
still
a,
difficult.
I come from a very middle class family, so I did not have enough money to pay capitation when I was about to enter the medical school. So I have to wait for 4 years to get into medical school to get a seat. So that was one of the biggest challenges. And afterwards, going to England, coming back with degrees, and able to help the people is again another opportunity. But challenges wise, there are many, because India is a country of vast dimensions, and there is a lot of professional rivalry, professional jealousy, some unethical people practicing around you who are cheating the patients. For example, injections into the joints. Some people claim that by PRP injections are good for the joints. They treat everything, so which is a very false. So I fight against them. So those sort of unethical, unprofessional practices around me disturb me sometimes. That's the biggest challenge.
How is this yoga and meditation basically helping toward it?
Yeah, that's a good point. Yoga and meditation is very good, and they are wonderful to the body. But yoga has got a bit of limitations. I don't say limitations. You should be careful about yoga when you have a arthritis of the knees and hips. So from my perspective, if you got a advanced arthritis of the knee, Vajrasan, Padmasan, and Surya Namaskar second half are not right.
Not right.
You should not do them. Some yoga teachers fought with me, saying that I am belittling yoga, but no, never.
Okay.
I greatly admire yoga. In fact, I try to do yoga as much as I can. My wife does yoga every day.
Oh,
Every day.
that's really
So
great.
I'm a great fan of yoga. There is no doubt about that. But from an orthopedic surgeon point of view, there are some asanas which will aggravate the problem of the knee joint.
Exactly, because there are a lot of yoga instructors right now in the market who has just done normal 50 hours, but it's again I'm just taking it in a positive way, because at least something they have done the good.
Yes.
Even though they are not expert, but still they are the.
I agree with you.
So seeing the positive approach when you are healing anybody, the physical blockage, how you're opening up their inner blockage. It is said like mano buddhi ahankara chitta ninani, right? So it's just like inner delusions of the mind and the toxins accumulated in the mind and in the body. So how it is completely, because you can heal and then.
Yeah, you are very right. Mental healing and emotional healing is a very important part of the reform. That's why we see, in fact, some people come from village. They don't know anything. They don't know anyone. They come, they get operated. Second day they are gone. They won't come back again. Some people come with big recommendations, come from big families. They keep on grumbling, crying, and they will get complications. So definitely I feel and I'm sure there are positive chemicals which will increase your recovery. Like that, there are negative chemicals which will hamper or which will dampen your recovery. That's why sometimes whenever the patients come and apprehensive, I sit with them, hold their hand and explain to them, look, if you are apprehensive, come some other day. Or if you are apprehensive, this is the way to go. But if you approach the surgery with a negative mind or a scared mind, this will translate into post-op complications. So like good chemicals, bad chemicals. So that's what I would say.
So is it like a different kind of a settings? You treat them mentally or
Every patient I treat them mentally.
mentally? Because there is a huge mob gathering you.
Yeah,
towards-
mentally means it's just whenever I talk to their soul and I talk to their inner self and I explain the analogies. I showed them examples like that. I just don't. Every patient I'll talk to them by their name. So those are all very important things in establishing the depth of the conversation.
So when the body starts healing physically, do you believe it is spiritually asking to have some pause? How spiritual you are, I would be saying, in terms of modern science.
Yeah, so I'm absolutely, I should say, spiritual. I'm not spiritual at all. I believe there is a superhuman power who is guiding us and who is helping us. But it need not be a God. So I don't go to temples. If at all I go to temple, I go to temple to see the architecture. So I pray to God every day just for 1 minute standing there in front of God's room and say that God give me the strength. That's all. More than that, I don't follow rituals. I don't do pujas. I don't do those sort of things. So for me, God is in the people.
Yes.
Yeah, people, Manav Seva, Madhav Seva. I strongly believe that. And I feel that all my patients whom I treated will pray for me. So why should I pray?
Sir, you are getting every day. You're so blessed to have people who bless you every day.
Yeah.
Because you're in that position. You have gained with your hard work and everything.
You're
And
absolutely right. Yeah.
this is something I'm fortunate. I'm honored to that. I'm just having this valuable point from you. I would like to ask you this thing. When, like, being a doctor, you're completely emotionally attached to patients. What is basically when you see that now this patient is at the final stage of the life, there, how you manage when he is in the time to depart and or is in a very heavy trauma, what is your final words to them, because they are having a lot of hope on you.
Yeah, I know.
Then how do you manage that?
Of course, I being an orthopedic surgeon, very rarely we get patients like that who are on the terminal stage of the bed. No doubt, bone cancer patients, some patients come, but rare, unlike in cardiology or medicine. So our people come in the wheelchair and go out walking happily. So 90% of our practice is seeing the patients happy and going home. But the question you ask is very pertinent. I came across some of the patients who developed complications secondary to operation. I could not save them. And I just go and hold their hands, look at their eyes and say that things have turned from bad to worse, but nothing much we can do, but we'll do our best. So we'll see how the things go. But you hang on. I'll try to reinvigorate them with their inner faith, and I give them my soul. I try to do that. I spend time with them.
That is the best
Yeah.
part. That is the main medicine.
Yeah, that's what I'm saying. Yeah. But another thing is any relationship, especially this doctor-patient relationship, depends on the 4 T's: time, trust, touch, and talk. These 4. Any relationship can be maintained in the world.
I will be definitely noting this, and this is something is a very insightful, but like your philosophy, I would say. It came up and somewhere like our vision is also somewhere is little bit depend on the L6 philosophy. Like, love, leisure, lust.
Yeah.
Live and live.
Yeah.
So this is something is our vision,
Yes.
mission,
Yeah.
and this is on that we are working out. And I understand because we have taken a lot of time here, and I have already taken your much time. But thank you for everything. I would be saying that with your inspiring journey and the conversation, the insightful conversation what we had, I got to know that health is not basically the absence of the illness. It is the foundation of managing the life,
Yeah.
main side.
Yeah.
And this we need to take care of this. We are living the life, but we are not full awarely we are living it. Awareness is very important,
Yes.
and that may keep you away from.
Yeah, you're very, very correct in that. Health is not just an absence of disease.
Yes.
It is being more positive emotionally, physically, socially. You're absolutely right. So that's why I keep on telling existing is simple, but living is profound. If you don't have any meaning to the life, that is existing.
Existing, yes.
But the life comes with the meaning. So that's what.
Somewhere I'm touched with the kind of, this is in the Hindi, Dadi Ma Ke Nuske. Somewhere I'm touched with those kind of treatment, I believe, little bit. Because when the poor person like me, who is not able to reach to a good doctor, and then that time, we try to manage to heal ourselves by the Dadi Ma Ke Nuske, like our grandparents, what they said, put mehdi. It will keep your body, skin cool, and apply, be like senseful what you're doing the work and all. All these small things actually calculate a lot. So thank you once again.
Thank you. It's my pleasure.
My pleasure too.
Yeah. Namaste.
Namaste. Thank you. Namaste.